Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County. And today is November the 29th, the week after Thanksgiving. And this is another of our weekly updates. This is also a chance for us to answer your questions. And we got quite a few questions this week about the Omicron variant and some questions about the booster. And we'll be going through those questions today. But as always, if you want to submit questions, send them to us at Facebook questions at douglaspublichealthnetwork.org, and we will get to them on our next recording. In the world, it's a little bit worrisome. We're starting to see an increase in cases in Europe, especially in places like Germany and Belgium, places that have already had a moderate amount of disease and a high vaccination rate. The disease in those areas is, again, mostly among the unvaccinated. And in those areas, almost all the older people are vaccinated. So it's hitting mostly younger people. And thus, they're not getting quite overwhelmed yet with hospitalizations and deaths. But the worry is that there are pockets of low vaccination in those areas, and it certainly could cause some troubles. The other big news this week is an increase in cases in South Africa. Their cases are up 1,700% over the last 14 days, and we think this is due to the Omicron variant. We'll at the end, we'll talk a lot about the Omicron variant. In the rest of the world, things are pretty quiet. We are still seeing very low amounts of disease in North Korea, Taiwan, Japan, Australia, and New Zealand. So all of those have relatively low amounts of disease, although some of them have started to notice a few cases of the Omicron variant. In the U.S., cases are pretty flat, although it's always hard to know about cases during a holiday week. And because during a holiday week, the testing changes. Much of the testing is pre-travel testing, and thus the positivity rate is lower. But on the same hand, people who are sick may not be able to get into urgent cares, and thus the amount of testing for sick people may be down. In any case, it looks like cases in the U.S. are kind of flat. Hospitalizations are starting to rise, though, and that really is a worry. Most of the cases in the U.S. are in the northern states. So we're seeing Maine, New Hampshire, Vermont, upstate New York, Michigan, Minnesota, and Wisconsin have increasing number of cases. And that's a worry, because that suggests that as people move indoors, as the weather gets snowy and otherwise cold, that may see an increase in number of cases. And with the Thanksgiving holiday, there was quite a bit of travel, quite a bit of mixing around the country, and we're worried that in the week or two after Thanksgiving, we might see another increase in cases. Oregon has a declining number of cases now, well below the national average, and the disease, there's no one really hot place, although most of the disease is east of the Cascades, especially in Deschutes County. The number of hospitalizations, though, still remains pretty high, still in the 300 to 400 range, and that is a bit of a worry. Douglas County has been totally flat. And we had our big surge in August and September, went down to about 30 cases per 100,000 per day. And we're kind of stuck at 30 cases per 100,000 per day over the last 6 weeks or so. We continue to see new cases, mostly at workplaces. We had several new workplace outbreaks over the weekend and in nursing homes. So we're really starting to see the areas that we've always seen, and there's always a lot of spread within families. As far as hospitalizations, we've had about 30 hospitalizations over the weekend. Some of those here in Douglas County, and some at other places around the state. Most of these hospitalizations now are in older people. As the case counts come down, it seems to be the older people who are primarily affected. Vaccinations continue to slowly increase, but really slowly. We in Douglas County are about 50% overall vaccination, considerably less than our neighbors to the north, and considerably less than the national average. Those 18 and above, about 60% are vaccinated. And when we look at our cases, overwhelmingly, they're among the unvaccinated. When we look at our hospitalizations, they're really overwhelmingly among the unvaccinated, and our deaths are similarly among mostly the unvaccinated. So vaccine still seems to be working, probably about 80% to protect hospitalizations, about 90% to protect deaths. So we are really still wanting people to get vaccinated. Boosters are available for basically everyone, every adult who got one of the initial vaccines. If you got the Moderna or the Pfizer, we recommend a booster 6 months after your second dose. If you got a J&J, we recommend a booster, and the booster can be with any vaccine 2 months after your dose of J&J. J&J has been the least effective of the three, but a J&J boosted with Moderna or a J&J boosted with Pfizer gives you really excellent protection, and we would certainly recommend that. The big news this week is about the Omicron variant. And so variants develop, and they develop all the time. Most of the variants that develop are really not much to worry about. They're little nonsense mutations. So I'll repeat a story which I used in the beginning. Imagine if you were making a recipe for, say, a cake, and you made a mistake. Instead of saying 1 teaspoon of butter, you had 1 pound of butter. Obviously, the cake would be ruined, and that recipe wouldn't spread. However, let's say it called for a teaspoon of rum and you put a tablespoon of rum in it, and that really improved the flavor. That recipe then would be well accepted, and that would spread more among people. And so, like with all variants, we look at how fast they spread, how well they replicate, how serious disease they cause, and whether they're well controlled by the vaccines or by the Regeneron, which are these antibodies. So we started out with what we call the ancestral strain. That was the strain that started in China. Around the summer of 2020, there was a mutation called the D614G that came in. And within really just a few weeks, almost all of the new variants had this D614G. The D614G is a single mutation. And what it did is it strengthened the stalk of those little balls that are on the surface of the virus. And as it strengthened the stalk, it made the virus more easily transmissible, and you had less breakage of these little spikes. So when that happened, the disease was more transmissible. Then around the wintertime, we started seeing lots of new variants. The biggest one was the Alpha variant. The Alpha variant was a combination of about 30 different mutations. It started in the UK. It spread very quickly in the UK and then came to the US about 6 weeks later. The Alpha variant was a bit more transmissible than the original one, and it was a little less well affected by the vaccines. Then come the summertime, and the Delta variant came up in India, and the Delta variant had, again, a lot of mutations, over 30 mutations. And when you looked at the Delta variant was much more contagious, started much more quickly. So instead of being sick in 5 or 6 days, we were seeing people get sick in 3 or 4 days, and was still quite as serious as the original ones. There were other ones too. There was the beta and the gamma, but they didn't spread very much. So what we started off with the ancestral strain, then we went to D614G, then we went to the Alpha strain, and now to the Delta strain. And then last week, they began to notice a flurry of cases in South Africa. Now, South Africa before 2 weeks ago had a very low number of cases, 1 or 2 per 100,000 per day, a number we haven't been at since many, many months. And then all of a sudden they started increasing. There are about 8 cases per 100,000 per day, mostly in an area in the north part of the country. This is an area where there are a lot of students, and they saw it spread quickly among students. A couple of things they noted. One is that they saw some breakthrough cases, making us worry that the vaccines did not give good protection. But they also saw that most of the cases were mild. We don't know what to make of this. Again, if you look at a college age group or a young people group, cases are likely to be not very serious because young people tend not to get very sick. And so we don't know what's going to happen when this starts getting into the rest of the population. The other thing that has been anecdotally noted is that people who have this have more headache, fatigue, sore throat, less cough, loss of taste, and respiratory problems. So that was just a very, very, very early signs. It now has unfortunately spread. There have been cases noted in other countries, including Hong Kong and in Europe. So we worry that this is probably already spread, and we just need to know more about this. Now they name these variants starting with alpha, then they went beta, gamma, delta. Then there's a bunch of little ones in between that don't seem to be really important. This one is Omicron, Omicron, which is the 15th letter Greek alphabet. And Omicron is going to be something that I pay careful attention to. Because when we look at these variants, there's a couple of things we want to know. One is, how transmissible is it? If Delta was problematic because it was much more transmissible than the earlier ones, probably 3 or 4 times more contagious than the original. And because it was so contagious, it spread so quickly. So if you look what happened in India, if you look what happened in the UK, and what happened here in Douglas County, is really within the space of a few weeks, we went from almost no cases in the beginning of July to just a tremendous number of cases by the end of August. So within 6 weeks, it just basically took over. So the question is, how transmissible is this? If it's not very transmissible, it's unlikely to outcompete Delta in most parts of the world. Second thing, to look at how severe it is. Delta, Alpha, Delta, and the original were all quite severe. There was maybe a little suggestion that Delta was a little more severe than the others, but they're all quite severe, leading to Douglas County a death rate of about 2% of the people who got the disease died. And so that's a lot. Most other diseases you have a death rate which is much, much, much lower than that. Flu, about 10 times less. And then if you get something like a common cold or whatever, 100 times less than that. So the 2% mortality rate was really a worry. Now, this has a similar mortality rate and is as transmissible. It's going to be similar to the Delta variant. However, there's a possibility it could either be much less serious, just causing cold symptoms, in which case that would be a good thing, or it could be more serious, meaning that more and more people would die. I think we have no clue yet as to how serious it is. And then the third thing is how well it responds to the vaccine and to the monoclonal antibodies. Again, the ancestral strain, the alpha, and the delta all were well controlled by the vaccine. The delta a little less than the others, but all pretty well controlled by the vaccine. The concern with this one is that the binding site, which is the part that attaches to the cell, which is usually the place that the antibodies attack, has a lot of mutations, and there's a concern that there's going to be enough mutation there that the vaccine, previous infection, or the antibodies may not work. That really is a worrisome problem, because if that doesn't work, we're going to kind of be back where we were back at the beginning of this, with no vaccines and no other treatment, and that would be really dastardly. However, we don't know any of this yet, and I think I would ask people to take some time. Let's see if we can learn about this. Like any of these things, when something new comes out, there's a lot of worry and a lot of concern and a lot of worry, some of which may be needless. At this point, is no cases yet in the U.S., certainly no cases in Oregon or Douglas County. So the point is, we're dealing with the old Delta variant, and we know the way to treat that. We know the way to get rid of that. The first is all those things we've talked about: masking, distancing, staying home if you're sick. And again, we've had a couple of outbreaks this week where people have gone to work sick. So stay home if you're sick, get vaccinated, and when you're in indoor spaces, to use a mask. In addition, we do know that the Regeneron works pretty well, so we're encouraging people who do get sick to talk to their doctor of whether they would be a candidate for the Regeneron. The other thing new that's happening today is there's a drug called Monopyravir, and Monopyravir is a drug made by the Merck company. And what that drug does is it causes the RNA replication to be disrupted, and so it makes false copies of itself rather than true copies, and in that way decreases the spread of the virus. Originally came out, they thought it was going to be 70 or 80% effective. I saw some stuff this weekend that suggests it may only be 30% effective. So I don't know what's going to happen with that. The FDA is looking at that today, and we should know later in this week if that's going to get approved. If it is, Douglas County will get our share of the doses, and we're going to have to figure out how many doses we get and how we can get this to the most vulnerable people. But we are getting lots of Regeneron at this point. So if you are if you're sick, talk to your doctor. You may be a candidate to get the Regeneron, which does seem to decrease the risk of hospitalization by 70% or so. So that's what we have for questions. Again, if you have questions for us, please send them to us at Facebook questions at douglaspublichealthnetwork.org, and we'll get to them next week.